Thanks so much, everyone, for joining us for today's program. Today, we're looking at preventing falls, and your presenter is Dr. Phu Hoang, and I'm Andrea Salmon, one of the Education and Wellbeing Program Coordinators, and I'll be facilitating today. We start all our programs by acknowledging and paying respect to the traditional custodians, past, present, and emerging, on whose lands we meet today. And today, I'm on the lands of the Wurundjeri people of the Kulin Nation. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and we respect the cultural authority of the elders in each community. It is my pleasure today to have Dr. Phu Hoang with us. Phu is currently works with MSL as our senior physiotherapist, and he also spends some time with Neuroscience Research Australia as a research fellow. Dr. Phu is working on a few projects aimed at improving mobility and reducing falls in people with MS. And I smiled at the word few because Phu's always working on research projects and has done so much work in this area. It is absolutely a privilege to have him with us in this space. So thank you, Phu.
Today, my talk within the next 45 minutes, I would like to present to you about the issue with falls. It's a huge problem among people with MS, and I will point out the characteristic of the frequent fallers so you know where you are, whether you fall in that group or not, and I will suggest some recommendation to reduce the falls there. And the first things first, and there is in the research, there is a very strong evidence that individuals with MS are much less physically active than non-disease but not disease population. And this is the bottom line of this one because of the disability in people with MS, so they are less active then. So in the next slide, you will see that with this kind of between the MS and people with MS and healthy control, you look into the right side is healthy control, and you can see that in the level of body function, that means about the muscle strength, about aerobic capacity, everything is reduced. And then the cardiovascular disease increase the risk of that, and increase depression, increase fatigue. And in terms of activity in daily living, you can see that everything reduced among people with MS. But from that one, the quality of life is very low. You cannot participate in social activity as healthy controls. So with this one, my point is we need to be more and more active. And the people with MS is totally capable to be more active as long as you have a good guidance. Next slide. And then when we look at this one, his son is from America. He conducted a study. He looked at 80 people with diagnosed with MS less than 5 years, and 80 people diagnosed with MS more than 15 years. And he asked question, what is the most important functional loss among people with MS? And the walking is the top of the list. The second one in this study is a visual function, which I am not 100% agree with. However, the point is either you are newly diagnosed with MS or diagnosed with a period of time, the walking impaired mobility is still the #1 issue among people with MS. The walking here including falls. So because I realized that falls is a huge issue among the people with MS, I started by myself. I look at more than 200 people with MS within Sydney to identify what factors make people with MS falls frequently like that. And results show that in this graph you can see that on the right side you can see 1 fall, 2 fall, and 3 falls there. Basically 60% of people with MS who are still mobile, whether short distance or long distance, will have at least 1 fall in the next 6 months. Among them, 40% will have at least 3 falls in 6 months. So this is a very popular problem. And then common problem among people with MS. And this study, and at the same time, next slide please, and at the same time, researchers around the world also focus on phones problem among people with MS. So we talk to each other, we combine the data from Sweden, United Kingdom, USA, and us. We have the biggest participant, and in the data, the combined data, including, next slide, the combined data, we have more than 500 participants, and the results show the same. So you look into the right side of the on the x-axis there, you have a 537 participants, and in the blue column there, so at least a 300, or 56%, nearly 60% of people to have at least one phone within the 3 months. In this data is showing the phone up in 3 months, and you can see, and then nearly 200 people will have more than 2 phones within 3 months. So again, around the world, or in Australia show the same issue. So phones is a highly prevalent among people with MS. So we put together and we analyze the characteristics and consequences of phones in MS. So we put together and we found this one. We have in this study, we assessed 150 people, and we recorded more than 500 phones in 3 months. And this phone is occur during the day and occur indoors. Indoors mean when we transfer in the toilet, transfer between the bed and the wheelchair, blah blah, and or during the personal hygiene, or that one. So mostly it happened during the day, because at night time sleep anyway. So but among on the phones, nearly 50% related to walking. So you walking means you move from A to B to C. That's when the people start falling. So this, I think that many attendants are listening here. You can relate to yourself, how you fall, why you fall, and it's reflect your personal circumstance. So in some, this is the highlights of the characteristic of the foreigners in MS. Number one, they have impairment in balance, and number one is a higher EDSS score or higher disease step. By the way, if you are not familiar with EDSS score or heart disease step, I roughly give you an idea. EDSS score is the rating system of the disability among people with MS that neurologists use in order to rate the disability level. 0 is nothing. 9 is a bad bar. So anyone move from there up to number 5 or number 6, you need to use a walking stick or a walker to walk. And the balance impairment is number 2. Number 3 is you have a problem with walking, spasticity, stiffness in the ankle. You have to use a walking stick or walker, and you have a cognition issue. You have a weakness in the legs. You have fatigue, and you have a high fear of falling, and you forget, and you have a problem with the bladder. These are the characteristics of the frequent fallers in MS. So having understand this one, we try to really to deal with each problem. Depends on individuals. Some people have a few of them, some people have one of them, some people have many of them. So we need to address every issue in them in order to reduce a fall. First, I'm talking about muscle weakness. It is the most common complaint by people with MS. It usually happens in the lower limb first, especially flexor and hip abductor. I'm talking of flexor mean when the muscle to bend the knee or the muscle to lift the foot up, and the hip flexor mean the muscle to bring the knee up, or the knee flexor that mean to bend the knee. These are the muscles that mostly affected first in MS before other muscles. So it occurs very early in the process of MS. Even when you don't notice, even when a person with MS haven't been diagnosed with MS, they still symptom of this one happen, the muscle weakness, the earlier symptoms appear in the people with MS. And because understand that, I conducted a study in Sydney. I looked at 300 people with MS in Sydney. I did on the testing, and I found that in this graph, I quickly through disease step. You look at the x-axis. The disease step 0 is you walk normally, and disease step 6 is in the wheelchair. And the black line there is showing that on the y-axis is the percentage of the people with MS with muscle weakness. You can see even at disease step 0, there are still 10% of people with MS have muscle weakness, even they are walking normally on the street. And the gray area is just the confidence interval. That is the maybe the error of the study, but it's within, it shows that. But up to number 2, number 3 disease step, when you really don't really need the walking stick, a mobility aid, but you the gait is a bit limping, 60% of people at disease step 2 will have a muscle weakness in 1 or 2 muscles there. So that is my study showing that muscle weakness is a very popular among people with MS in this. So that is the good data to show that. That is the only data in the world. But the question is, can weakness be muscle weakness can be improved? The answer is yes, very strong yes. We have a strong evidence that with proper exercise we can improve the muscle strength significantly up to this point. And we know that progressive resistance training, we do it over long enough period, it will improve the functional capacity like walking and on other stuff. So basically we have a strong evidence of that and you need to focus on strength exercise is very important there. Unfortunately, I cannot show the video because of the technology. However, in this photo on the left side, you see this is Ross Patterson. Dr. Ross Patterson is a medical doctor. He was diagnosed with MS for 17 years before seeing me, and he had to stop working because of his wobbly, and he had to walk with the walking stick like that. This is the picture taken at his own house when I tested him there. And then he walked like that one, but after 6 months, 3 months exercise properly, he can walk very confidently, very nice posture. He can walk in my at my research facility and in front of his house in Marupra there. He can walk very confidently, and he was a very happy man. The issue here, and then the problem is in MS, they have a relapse. Unfortunately, about 1 year later, Ross has had another relapse. He couldn't walk properly. He couldn't lie there. He couldn't bring his knee up properly either. So unfortunately, you don't see the video, but the video you see, he was extremely weak in the hip flexor. He couldn't bring his knee up in this position. And then we had to return back to square one. We exercise again, and again he recovered, and he can walk in front of his house, and he could even run like a jogger in front of his house, and he was very happy. He said that since he diagnosed with MS, he could never run, but now he could run again. So again, I would like to point out that if you do the strengthening exercise correctly and good enough, long enough, you will improve the muscle weakness. The case, before we move on to the next one, I would like to tell you the case here. This doctor, this patient, he has a muscle weakness and muscle imbalance, but he was diagnosed with ataxia. Ataxia means you have a very, very wobble walking gait. Ataxia is showing the lesion in the cerebellum, and the ataxia is something you can never fix it. You can get worse, you can get to fix it, very hard to fix it. But when I see him, and I know that he didn't have ataxia, he just have the muscle weakness and muscle imbalance. So we focused on strengthening, and he got to that point, and that's good news for him. The second point, to make people with MS and fall a lot and difficult in walking is the spasticity. The word spasticity, some people may not be familiar with, some people familiar with, but they describe as feeling the muscle drawing or pulling. What is spasticity? Spasticity is that it change the skeletal muscle performance, and it make the muscle become weak and increase the tendon reflex and hypotonia. That means you have a very stiff, like you cannot bend the knee because of the stiffness in the thigh muscles at the front. And people come to the doctor, complain of, I feel very tight in my legs and I couldn't bend the knee, I couldn't do anything. So that is the characteristic of spasticity. This is the hardest issue to deal with in MS. So again, we don't have the video to show how this gentleman walked because of the spasticity in his two legs, but I just want to show that they call it spastic gait, means they're very stiff. Unfortunately, we don't have enough space in order to show you the video. However, on the video there, I will try to put on YouTube or something and give a link to Andrea. And Andrea, if you guys want to see how this video works, you can communicate with Andrea, and Andrea will give you the link into the YouTube place in order to see that one. Okay, so we are talking about management of spasticity. As I said, it is one of the most difficult issue in MS to manage. The most common thing the doctor will do is to give you an oral baclofen. But usually up to now, every doctor, every neurologist know that oral baclofen sometimes, and most of the time, not sometimes, most of the time doesn't work. And if oral baclofen doesn't work, they come to the intrathecal baclofen and do the pump of baclofen in your spinal cord. It is a very invasive measure, and not many people prefer this one. So I wouldn't go into this one. And sometimes doctor give you do muscle relaxant like a Valium or diazepam in order to add to oral baclofen to reduce the stiffness. So medically, it's not very effective. So how about the physiotherapy? I will talk about physiotherapy to manage spasticity in the next few slides. And one common thing among the rehab specialists is Botox. When the person with MS presents with very stiffness in the legs, the rehab specialist likes to put the Botox in to reduce the stiffness. However, the Botox, as you know, it is a toxin. It paralyzes the muscle. It may remove the stiffness, but it's not helpful at all. Because if you paralyze the muscle, how can you walk? Not mentioning that you may fall because of the muscle weakness. Even you remove the stiffness. And by the way, in some situations, spasticity is a bonus among people with MS if they have very weak muscles, because spasticity will act as a splint to hold the leg straight. Otherwise, the person will collapse and cannot stand up properly. Spasticity, in some cases, it is a bonus, but it depends. That's why when we deal with spasticity, we need to consider whether we need medical to reduce it or not, or how we deal with that. That is the difficulty of the issue. Recently, many people they try to use a marijuana-based pharmaceutical, but the medication is still not on BBS, and it's very expensive, around $750 a month for average dose of people. However, while we are on this topic, at the gym at Lickham, some people they have a very severe spasticity. Nothing can be done, and they cannot go into intrathecal baclofen, the pump. So I advise them to use marijuana-based pharmaceutical, and they use a CBD oil, THC oil, and it works. It works. So in a few specific cases, if nothing can be done, we can turn into this kind of marijuana based medicinal marijuana, something like that. It may help, but we need to be more careful about that. We need to discuss very carefully with the doctor and physiotherapist about this kind of usage. Now I elaborate a bit more about the oral spastic agent that we're talking about, baclofen there. The many of you here may have spasticity and may be taking baclofen, but I would like to raise some factors to consider when taking this one. You do not know the side effects. The side effects of baclofen is to make on the muscle weak. It causes a general weakness. And if you are very low dose, it may not be effective. But if you want an effectiveness of baclofen, you have to be in a high dose. But the high dose will weaken your muscles. So basically, again, you can reduce the stiffness, but you weaken the whole muscles. So we have to balance between the benefits and harmful side effects of that. And we also ask question, is it necessary to do or not, to take it or not? For example, some people, they have a spasticity and they only experience the difficulty at nighttime when they sleep. And during the day, they don't have a much problem with that because they do have a spasticity, but they can still walk around. And then if that is the case, the baclofen during the day is not necessary. But if at nighttime the spasticity wakes the person up a lot, many times, they cannot sleep, they have a disrupted sleep pattern, then you can take baclofen at nighttime only. The habit or the routine, the doctor say, okay, you take a 20 milligram of baclofen 3 times a day. Sometimes I found that daytime dose is not necessary. I only keep the nighttime dose. And on the other hand, if daytime you feel very hard to walk without the baclofen, take it. At nighttime, you don't have problem with the spasticity, why taking it? So basically, my point is, even the dose advise you to do 3 times a day, but you need to consider whether you need it or not. And look at the frequency. Yes, that's all I can say about the baclofen. Now, talking about physiotherapy for the spasticity. Up to this point, there is very little evidence showing that physiotherapy intervention may help with spasticity. However, because I have to work with the people with MS every day, and spasticity is a common problem among at least 80% of them, so I have to find out at least what intervention can bring some effects, even temporary. So the following slides will show you some of the physiotherapy intervention may help. The first one is we call it PNF, or full word is a proprioceptive neuromuscular facilitation. This is a kind of a through the range stretch relax technique. In these pictures, you still cannot see much, but you just you remember the word PNF. If you have spasticity, if next time you see your physiotherapist, you can ask your physio what PNF is, and you can practice some PNF. I'm pretty sure that it will help relieve the spasticity for a short period, say about 30 minutes. And this lady in the pictures, she has spasticity in the thigh, very steep. And before the exercise, she does the PNF stretching here, and it helps the muscle relax about half an hour, so that she can practice on other exercises and walking better. That is one way I found that it may work. It may give you a benefit to reduce spasticity. I don't know how long a person need to do that in order to have a permanent effects. I haven't had a chance to test this question yet. That is number one, to deal with spasticity. Number two is the vibration. In a study with the vibration to increase the muscle strength in people with MS, we found that the vibration, this is an accidental finding. We found that the vibration may help reduce spasticity in the thigh and in the calf muscle a lot. So that's why, and in these photos, this lady always come to the gym, have a very stiff legs. She used this vibration for machine for about 15 minutes, and then she walk much better, much faster, and she do exercise much easier. So this is the second modality that I think that it may temporarily help people with spasticity to reduce the stiffness in order to perform better. So in summary about that, how to improve that one to the people, how to improve that one. So what can your question is, what can you do to improve your body function and to reduce falls? You need to exercise, and then you add more exercise, and you keep going with exercise, because exercise will be the way of life from now on. I'm sure, because I've been working for MSL for more than 20 years, and I know that someone, if you stop exercising, it will be affected. You will go down. You will go down immediately. So keep exercising. So, but before I leave you today, this table I recently wrote for the exercise body in Australia, to show the people with MS and to show the health professional who work with people with MS what exercises you should do. You have to do both aerobic exercise and strengthening exercises. In this table here, I think that this is the summary of what I would like to share today. You should know about the frequency, the intensity, the time, the type of exercise, and how to progress the exercises. Within this time frame, it may be a bit hard to explain everything, but I believe that with this table, you can read it, you understand it, or if you can show to your health professional like a physiotherapist or exercise physiologist, they should be able to explain to you and to stick to that and to help you to improve the body function and the physical activity there. This is one of the latest table I produced recently. So if you have any question, I think this part belongs to Andrea. Andrea, you can go from there.
That's great. Thanks, Phu. I will give people a chance to write in their questions. So remembering to find your control panel on the right-hand side of your screen with the tiny little orange box with the white arrow. Click on that to open your control panel, find the question heading and click on the little tiny white triangle, and that opens the question pane where you can type in your questions for Phu. And just to give you a chance to do that, I will remind you that MS Connect is available for you to call and ask any questions. So if something from today has prompted you to ask another question, by all means ring MS Connect, and the girls there will connect you to the right people within or outside of MSL to help answer your question. And the other thing I'll encourage you to think about is peer support. We've got some fabulous peer support programs, and particularly as Phu's talking about the importance of exercising, sometimes it's that opportunity to connect with your peers that encourages you or helps you find something that you will find that you can continue with. You know, exercising on your own can be so hard, but exercising in a group or having someone to go with can be really beneficial. So don't overlook the benefits of peer support. The other thing to just encourage you to think about too is if you're in the workforce, connecting to our employment support service is really important. And if you're under 65, the NDIS is another way that both the ESS and the NDIS programs can assist you with some funding to access exercise programs. So, you know, again, don't let finances be the barrier to you exercising. We really want to get you exercising. My aged care might be relevant if you're over 65, and if you're having any trouble with that, you can certainly connect to via MS Connect for some support. another prompt around podcasts and other programs on our website that can be really helpful in this area to give you some more information and encouragement. So let's go over to questions. So a question, Phu, on the benefits of stretching in general. We've always talked about stretching. Can you give us a bit more information about the benefits of stretching?
Okay, the stretching, I did a systematic review and published in the British Journal of Medicine. And then we know that in general, stretching is good for improving on your better performance during exercise or during sports. But if we say stretching to avoid injury during exercise or during sports, it's not true. But stretching, yes, it helps to improve your performance during exercise or during sports. Yes, it works. However, in my talk, I talk about PNF. It's different way of stretching. So it's very hard to describe how to do PNF stretching within this context. However, bring the word PNF to your health professional. They will explain further.
Great, thanks, Phu. Phu, as the disease progresses, is exercise as effective as it is in the early stage?
Okay, so that is a good question. Up to now, we have evidence that showing that exercise is good for any EDSS up to number 7. What is up to 6.5? 6.5 means the people who walk with a walker, four-wheel walker. The benefit of exercise in the wheelchair wheelchair-bound people is not as strong as the less disabled group. However, from my experience here, we have a plenty of wheelchair-bound people in our gym, and I find that exercise at least maintain or slow down their deterioration. For the people with the EDS at 6.5 or lower, the exercise always effective as long as the health professional guide them into a proper exercise and focus on what need to do, not in general exercise.
Right, thank you.
There
And
is
Phu,
another, sorry, there is one more important thing that actually there is a preliminary evidence showing that exercise can slow down the progression of MS. And that is a big question. And then at the moment, in Sweden and in Sydney, I am collaborating with other neurologists in order to look into how to prove this point. So regardless, exercise is good, but exercise give you the benefits. Slowing down the progression is a very complementary with the medical management then, and it's very basically the exercise very close to the magic pill.
absolutely, absolutely. Phu, have you got any suggestions on how people can manage or avoid muscle fatigue when they're exercising?
Okay, that is a good question. The muscle fatigue in people with MS have two origins. One is from the central. The central means the lesion in the central nervous system. When you exercise, you have to generate action potential, but the action potential have to jump over the lesion in order to get the message to the peripheral muscles to activate. So after a little while, you have to jump over and the brain tired. They cannot jump over the lesion. So that's why no signal come to the muscles. That's why they fatigue. They cannot generate the force. That is the central origin. Now talking about peripheral origin, if the muscle is not very active in the long period, on the on the muscle elements there, like mitochondria, everything needed for the muscle activity will deplete. So you have two origins. the depletion of the active ingredients in the muscle itself, and the reduce action potential from the central. So these two origins make your muscle fatigue quickly with the exercise. How to improve that? To improve that, the only way to do is to do aerobic exercise. To build up from your where you can tolerate, you build up the your aerobic capacity, and in the long run it will improve the muscle fatigue due to physical activity. And I'm talking about here, if you do that also, I would like to point out that if you do aerobic exercise hard enough, long enough, it will produce a few substances very important. They call it the NGF and BDNF, mean the brain-derived neurofactor. They help to repair the lesion. And there is some evidence showing that the aerobic exercise can help partly or little, not very strong evidence alone, that it can help to keep the lesion in the central nervous system as is or smaller. So the benefit of aerobic exercise is very big. So need to focus on aerobic exercise to answer the question you just raised.
And so is there some benefit to alternating leg exercises and then arm exercises so that you're reducing or preventing that fatigue from setting in?
Yes, that is a good strategy to alternate exercise. If you if but from my in any neuro rehab gym, we always have the equipment for the arm exercise only, because arm where the less fatigue than the legs, because legs are more effective in people with MS. And you're right, one of the strategy is to switch between upper limb and lower limb to continue with your aerobic exercise to avoid the fatigue in the muscles, and you can keep going on to build up enough the intensity of the aerobic exercise to benefit from this type of exercise.
Thank you. Gail's got a question that's quite a practical one that I like. Is there something specific you should do when you have a fall? For example, a particular exercise. She had a fall yesterday. She got up, made it to the car, and just then sat down and rested. But should she be doing something else?
Okay. No, you don't need to say. You don't need to do anything else except one thing. People, when I work with the people who fall frequently, the first thing I teach the people is I put the people on the floor and teach them how to stand up, because the stand up from falling is a very important. So how to stand up? Oh, it's a very bit hard to talk without seeing anything, without showing them. But you need to basically, when you fall up, the first thing you need to do is, number one, don't move anything to see what if you hurt anything else. Leave it there for about 30 seconds or 1 minute to see if any serious thing in your body broken or pain. If no pain, you start slowly. You start. Try to be on four. That means on both knee and on the hands, and then find a way to stand up from there. That is how it works. How I teach people how to stand up from falling on the floor. But I take this chance to want to tell early next year, my group from Neuroscience Research Australia will roll out to continue with the intervention to reduce falls within people with MS, among people with MS. And we are using a smart stepping mat that we have been using. Some people, some listeners here may have been in that study, but we continue that study, and we will we will send a message to everyone to know that when we are starting early next year, we show how to exercise to improve your reaction, to regain your balance once you lose your balance and you are on the verge of falling. And we want to train the people how to react to that, how to regain your balance before you fall. That is the most important thing. So stepping exercise with some cure or something like that is what we are trying to do, and that study will start early next year.
Thanks, Phu. Are yoga and Pilates helpful as well, do you feel?
Okay. In general term, yoga and Pilates are very good for anyone, not only for people with MS. But if you ask me, is yoga can make a weak muscle stronger? I don't have evidence of that. At the moment, I try to read everywhere. There is no study showing that yoga can improve your muscle weakness or improve your spasticity. Balance, if you have a normal muscle strength and you practice yoga, practice Pilates, you can have a better balance. Yes. But if you have a muscle weakness, you have a spasticity, whatever you do, you may not improve on that. You need to be more specific. Specific here, you have a muscle weakness, you have to strengthen it. You have a spasticity, you have to deal with that. Yoga and Pilates, it's in general very good in any way. However, it doesn't address the specific issue I just not talk about.
Yeah, fair enough. That's a good answer. And finally, because I know we've reached our time, but Sally's wondering how people go about finding the right physio who has experience with MS.
Oh,
So that they can start an exercise regime. It's very hard, she feels, to find people who have that expertise.
that is a very hard question. I don't know either. I don't know either. However, have understanding this issue at the moment. So I am working with the managers of MSL. I'm looking for a budget so that I can produce about 50 or 100 short video put on the website here for the reach of any physio out there in the rural area. They don't have a contact, but they can. I will go over the common problem in people with MS and show them how to deal with that, what to do with that, and how to progress the exercise. I will put on the video there on the website of MSL, and any health professional can access to that. That is the best way for me to help on the physio out there. Ask me how to identify a good physio, I don't know.
No, it is quite hard. But I would add that during COVID, we were able to start telehealth as a service. So I'll make sure everyone gets the information on how to access an assessment via telehealth, if that was an option. And the other thing I would encourage you to all know, is that we do run an annual professional development program. So if you're working with a health professional who, in your teamwork together, identifies that they need some more education around multiple sclerosis, send them in the direction of our website and our health professional area of the website, because that Sally makes a really good point. There are lots of health professionals in all aspects out there who don't have a lot of experience working with multiple sclerosis, and so we work quite hard to try and build their confidence and their understanding and experience through their own professional development. So yeah, we can help guide you into getting the right support that you need. Thank you so much, Phu.
And there's one more issue here. You're talking about health. The last telehealth, in the last webinar, there are a few people who booked to have a telehealth with me from Melbourne, and after doing the assessment via telehealth, and that person decided to fly to Sydney to see me in person in early December. However, my point is, wherever you are in Australia, if you want or you like to have a face-to-face assessment with me via telehealth, you can ring MS Connect and book in to see me, and we can organize a telehealth. If you have a good computer, you have a good Zoom, I can access over the Zoom. I can see how you walk, how you move, and if you have your health professional next to you, we can discuss your case easier. That is how I did with a few clients in Melbourne.
And that's a fabulous option. Yeah, absolutely.
Yeah.
Thank you so much, Phu, and thank you everyone for being online today. Thanks, Phu, for your time in putting this program together and sharing your expertise with us. We're getting lots of thank yous coming through in the question area as well, so that's great. We will look forward to seeing you at another webinar in the future. And don't forget that MS Connect is there for you to ring, ask any question. There's no such thing as a silly question. That's what we're here to help with. So thanks everyone, and thanks again, Phu. See you next time.
Bye bye. Bye bye everyone.